Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is conducting an office visit with a 42-year-old male who is in treatment for the management of symptoms related to problems in his marriage. During the visit, he begins to cry, and the psychiatric mental health nurse practitioner responds to his tears by gently moving a box of tissues toward him. This is a facilitating intervention known as A. Reinforcement, B. Reassurance, C. Encouragement, and D. Acknowledgement. What type of facilitating intervention is this? So clearly this is an intervention question. In fact, it tells us it's asking about an intervention. And yet it is important to remember that many times as psychiatric mental health nurse practitioners, our interventions are more subtle. They are non-pharmacologic, and they are important for helping an interview to move forward, helping an office visit to move forward in a way in which the patient is comfortable, really sharing what's on their mind, what has happened since the last visit to influence their symptoms. So facilitating interventions are important. There are several of them. And while this doesn't necessarily mean that you are a therapist, most psychiatric mental health nurse practitioner programs don't prepare clinicians to be therapists. That's a different level of education and a different skill set. However, all of us really are accountable to be able to accurately employ these facilitating interventions, especially, I was going to say especially early in the patient relationship, but always during the patient relationship, not just early on, but even throughout the relationship. It is always so important that we know what is going on in their world, that they're comfortable talking to us about it. When we manage people for depression or anxiety or mania or whatever the symptom may be, and we manage them with medication, and then they come back for their next visit, and we find that they're not doing as well as we would have hoped. They're not having the response that we would have expected. It's not always because we need a change in medicine. Sometimes it's because something else is going on in their world to exacerbate their symptoms. In fact, in my own practice, one of the things I've learned the hard way, by the way, mostly what we learn is the hard way, that I always need to make sure there isn't an identifiable reason for a change in symptoms before jumping to a medication change. In other words, suppose I am managing a patient. Well, I'll give you an example. Very recently in my clinical practice, I am managing a patient who struggles with a very profound depression. And it has taken many, many, many months of polypharmacy to help her achieve a remission. And she had achieved a remission, and so it had been 3 months since her last office visit. And in fact, at that visit, she was asking if we could decrease some of her medications. And I said, well, let's just go 3 more months. Let's have a 3-month interval here, and we'll meet again in 3 months and see how you feel. And if you're still feeling that well, then we'll talk about perhaps down titrating something. And so 3 months went by, and she came back for her visit, and her depressive symptoms were much more prominent than they were the visit prior. But what I found out right away was that her dog had died. This dog now this lady doesn't have any other family. She doesn't have a significant other. She doesn't have children. She lives alone, and her dog was her child. Her dog was her significant other. Her dog was really, really important in her world for a very long time, and he died, and she was absolutely devastated. So of course, her symptoms of depression appeared to return. This has nothing to do with medication, and it's important to be able to find these things out. And so sometimes those facilitating interventions, those ways to help people feel comfortable in sharing all of the information they need to share, that's how you get the information that you need to decide whether or not you need a medication change or some other type of intervention. In a case like that, the patient was best served with a therapist or a therapeutic intervention rather than a pharmacologic intervention. And so back to our facilitating interventions here, there are 4 of them listed here, and the non-verbal act of gently moving tissues to this gentleman who became tearful during his visit, this would be de-acknowledgement. Acknowledgement is the correct answer. This is a form of non-verbal acknowledgement. It acknowledges emotion and often leads the patient to sharing more feelings. Now, these different facilitating interventions are not necessarily mutually exclusive. You will frequently employ multiple interventions during any one patient encounter, but each one isn't always necessarily the best approach. An acknowledgement in this particular circumstance, this non-verbal, just very quiet movement of moving the tissues toward the patient. This can be very effective in a man who is becoming tearful during his visit. Let's face it, men still are a little bit less inclined to feel comfortable being tearful in front of a provider, and it may be that the patient would even be uncomfortable if you openly acknowledged those tears. But by just quietly, gently nudging tissues toward the patient, you acknowledge the emotion, you encourage the patient that it's okay and to please continue. And so that's what this is. This would be acknowledgement. Reinforcements are more typically verbal phrases. These are just those brief phrases that urge the patient to continue. Things like "I see" or "go on" or "tell me more." Just very brief. It keeps the focus of the interview on the patient, but it reminds the patient that you are engaged and you are looking forward to more information. That's more consistent with reinforcement. Reassurance is a technique by which the psychiatric mental health nurse practitioner provides accurate information about illness that can very often decrease anxiety. In this analogous circumstance, you might consider to telling the patient that it's reassuring that he is tearful. It's very normal. It's actually very common and reassuring because it tells you, the provider, that he is emotional about his marriage and the problems, and that tells us he's engaged and he's obviously looking forward to things improving. Encouraging is characterized by providing a realistic assessment of the patient's progress or some positive contribution to the interview. You might consider, in this circumstance presented in the question, maybe in an earlier visit he wouldn't acknowledge a problem or couldn't acknowledge a problem. Maybe he couldn't bring himself to talk about it. Then maybe at the next visit he progressed to acknowledging a problem but refused to accept any responsibility. And now today, his tears are because he is seeing his responsibility in the marital problems. And so an encouragement as a facilitating intervention would be exactly that, perhaps briefly quantifying how the patient is improving so that the patient will be encouraged to go on. And so these facilitating interventions, they are an important part of what we do, and you are expected to be familiar with them.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.